Welcome to the Veterans Legal Lowdown. First things first, we want to give a shout out to our amazing viewers. We've reached 100,000 subscribers on YouTube, and we couldn't have done this without you. So thanks for watching, thanks for sharing, and continue to join us for exciting veterans legal content every month. We're happy to announce that you can now listen to us via Spotify, Apple Podcasts, or wherever you get your podcasts. So be sure to continue to tune in.
So on that note, we've talked a few times about the budget proposal. We want to get into the details of that today. Each year, the Department of Veterans Affairs, and we've covered this in the past, proposes a budget. The budget proposal is submitted to Congress, and it outlines the way that the agency intends to spend its money in the upcoming fiscal year. So the budget is very revealing. We take a close look at the budget because we want to know what are the agency's spending priorities, where is the agency planning to allocate funds, where can we expect to see significant changes up or down based on the funding that's allocated. So we've got a lot of numbers. We also have numbers in comparison to previous years' spending, which is, again, important for us to track just to kind of see where the agency is at in terms of prioritizing its different expenditures. So, and one note before we get into those specifics, this is just a proposal. The budget has passed the House. It's also been going through the Senate, I believe. I don't know if it's fully, as of today, I'm not sure if it's fully through that process, but it is in the midst of approval. And so we have the information today from the proposed budget. We don't have anything final. It's, of course, subject to change throughout the process.
Absolutely. And before we get into numbers, because I'm going to read some numbers and they're pretty big, keep in mind VA is a absolutely massive agency, and it's really three agencies in one. There's the healthcare side of VA, the VHA, which we've been talking about. There's the VBA, the Veterans Benefit Administration, which deals with disability benefits. And then there's the cemetery arm. So this really is three agencies in one. So this budget is quite large, but I've got some numbers for us. All right. So first and foremost, VA's fiscal year 2026 budget proposal totals $441.2 billion. Feel a little bit like Dr. Evil there.
Monopoly
but
money.
This is about a 10% increase from fiscal year 2025. So that's substantial. It is the largest budget request in VA history. Really no surprise. Obviously, costs are going up, but that's quite the budget. What is in a VA budget? So VA serves around 17.9 million veterans and their dependents every year. The operation of the largest healthcare system that we just talked about in the United States, with over 9.2 million veterans getting care at VA medical centers. The budget also includes disability compensation portion of it, right about 7 million or so veterans are getting disability benefits and their survivors or their family members. VA also offers a pension program, and that benefits over 200,000 veterans and their survivors. Every year, the VA medical centers operate about 162.6 million outpatient visits a year. So that's a lot of care being offered. Other things included in the budget include $3 billion for construction programs. So the actual physical spaces where these medical centers occur or the disability benefits have their operations, places for people to go, whether being new spaces or upgrading existing spaces. VA also manages a whole education assistance program for veterans and their family members, and about 1.1 million trainees are covered under this budget. Similar to that, the VR&E program, which I'm sure a lot of our viewers are familiar with, the VOC Rehab, the Veteran Readiness and Employment Program, benefits for more than 189,000 people for fiscal year 2026. VA also oversees VA loans, so the loan guarantee service benefits for 4.2 million veteran homes loans. Unfortunately, an interment of about 135,000 veterans and eligible family members to be buried at national cemeteries. So the budget really is broad. It covers all the spaces that VA manages, which is quite vast. And really, it's not surprising that it's the largest budget in VA history, considering the work that needs to get done.
And one part of the budget that we've already talked about that's definitely on people's minds is How will the budget reflect the agency's healthcare priorities, especially given the discussion we had earlier about community care versus VA care? So healthcare is receiving a substantial investment to enhance access and quality, which is great. The total combined healthcare funding that's proposed in the budget is approximately $165.1 billion. This is a 17% increase over last year. I think that's pretty striking. The major focus areas of the proposed budget and where the funds would be allocated are for community care expansion, like we've discussed. This would be a funding increase for community care of over 50% from last year's budget. There's also funds allocated, as there has been in the past, for mental health care and suicide prevention, and the continued implementation of PACT Act for toxic exposures. So that's another important one. We've talked about this in years past, and we're still seeing the effects of the passage of the PACT Act in 2022. It resulted in a huge increase in claims and appeals filed for conditions that are presumptive as of the PACT Act and as of that date. It's also had this effect of increasing the need for healthcare around those conditions. So it's good to see that that allocation is in the budget and that VA is thinking about expanding access and bolstering care for those veterans who were affected by the PACT Act and those new presumptions.
So that's a good segue into what I think a lot of people watching this segment are going to be super interested in is veterans' disability benefits. And so the mandatory budget for benefits is $301.2 billion for this fiscal year. And that's a sizable increase. It's up $34.2 billion. So again, ripples of the PACT Act and ripples of other pieces of legislation coming through as we see more and more folks filing claims for benefits or seeking to get increased benefits as their disability maybe worsens throughout their life. So VA keeping an eye on that and making sure they're allocating enough funds for the program. That budget covers disability compensation. It also includes the money for education benefits and home loans. So not just strictly straight disability benefits, but all three of those areas. Another interesting thing that VA is finally getting back to, and we'd talked about this in years past and have kept an eye on it, it's gone through a number of delays and twists and turns, is the Accelerated Electronic Health Record Modernization Program. I'm not even sure if this is a HERM or what. We have a lot of acronyms in this space, but EHRM. VA is allocating $2.17 billion for renewed deployment efforts. So they had tried this a while ago. It did not go great. I think there were issues with the vendor, or do you remember this?
Vaguely, and it's hard to keep this separate from other issues with other tech and other vendor type problems, but totally sounds familiar.
I vaguely remember congressional hearings. It did not go well. So we're reinvesting in this, which is great. And so I'll be excited to see what happens because certainly electronic healthcare records are super important, especially for veterans to get access to their own records as they may need them throughout their lives. Some other areas, infrastructure modernization is in this budget, $900 million for major construction projects. So we talked about how there's going to be I think about $3 billion for construction, but the $900 million is for major construction projects. And then conversely, there's also a line item here for reduction in staff for across VA. So although the exact amount is under debate and it hasn't really been published, we're going to be spending some more money, building up programs, allowing more veterans to get care while at the same time reducing a workforce. I think that's going to be an interesting situation to watch unfold.
Definitely. And this is something we've kept an eye on. We'll probably mention it later in this segment. So at the risk of repeating, we do know that the workforce reductions in government employees generally, but also with respect to the VA is concerning to folks who are wondering how it will impact their access to care or to speedier claim adjudications. I think every viewer out there who is either a VA claimant or a practitioner is not enthused about the prospect of fewer VA employees to work the pending backlog of claims and appeals. It just doesn't seem to make sense. So initially, the number that VA had proposed was around 83,000 employee cuts. That was months ago. Thankfully, we've seen some reports that have indicated that VA plans to shrink its employee staff by closer to 30,000 employees, so less than half of that 83,000 figure that was floated a few months ago. And VA has also said that the workforce cuts are meant to be accomplished by attrition. So that can mean organic retiring, not filling positions that have been left vacant, downsizing in a slower and more gradual way. That's what's being said. So definitely still a concern that there will be these cuts, as you mentioned.
Mm-hmm.
How can there be more claimants, more presumptive conditions through the PACT Act, more opportunities for different access to care, more specialties, and yet fewer employees? So that's definitely something that we will keep watching. But for right now, what we understand is that they've backed off that 80,000 employee figure for cuts, and they are moving more toward a 30,000 employee figure. So we'll have to see what happens with that. Another part of the budget, housing and homelessness initiatives. There is a major push. This is also consistent with previous years to reduce veteran homelessness with targeted funding. There's a dedicated $3.4 billion specifically for homelessness initiatives in the 2026 VA budget. There are also currently a half a dozen legislative proposals focused on increasing programs that will prevent or reduce homelessness through grants and rent assistance and other things like that.
Some other notable changes for this fiscal year. The total funding increase is about $42 billion more. So we mentioned largest VA budget ever. Resumption of that electronic health record modernization effort after previous delays. Enhanced community care funding, about 50% more for community care funding going into this year. Administrative staffing reductions, but increased funding for healthcare services, homelessness, or veterans at risk of suicide.
So a current status of where we are at with these budget proposals. This summer in June, the House passed a $435 billion version of the proposed budget. The votes for the budget were pretty close, 218 to 206 members of the House, and those were largely cast along partisan lines. In July of this year, the Senate Appropriations Committee advanced a $456 billion VA budget plan with broad bipartisan support. And the Senate version did make some changes. We're not going to go into all of them in detail, but they omitted some of the amendments that were contained in the proposal that did pass the House. So there were some more controversial amendments that were included in the initial budget proposal that were weeded out by the Senate. The Senate priorities still included access to mental health treatment, veteran suicide prevention, rural care, benefits, and GI Bill programs. And another point on the staffing issue that we've been talking about, the Senate proposal includes language that assures that veterans are, quote, never denied care or timely access to care as a result of the damaging or arbitrary cuts to the VA workforce. And so this I thought was really important to bring up because it's very clear from what we've read and studied so far that the Senate has those staffing reductions in mind when they're passing these budget proposals. So exactly to the point that you made earlier, Emma, the budget is not going to be a successful allocation of funds if the funds are spent in a way that doesn't have enough staff to be able to implement all of the initiatives that they would bring about. So I thought that was a really interesting observation and sort of sentiment behind the Senate's approach to the budget proposal. Still things that we need to keep an eye on. And this is all proposed, as we mentioned before, so nothing is final yet. But it's clear that Congress is definitely thinking about not just what funds will be allocated where, but how will those funds be able to convert into the initiatives that the agency has. And staffing is a really key part of that. The VA budget is very unlikely to be passed by itself. It's expected to be part of a full government package, and that is likely later to happen in 2025.
Yep. Stay tuned. As always, we'll keep you updated as future developments come in, especially once Congress returns from the recess. Be sure to follow and like this video, and be sure to join our 100,000 YouTube subscribers for more content. Share this episode with fellow veterans, and don't forget to leave questions for future episodes because we may be able to address those questions for you. Thanks for listening, and make sure to take care of yourselves, take care of each other, and keep the fight alive.